Mr. Nigel is an Ayurvedic practitioner trained in UK, and he got his degree in Ayurvedic medicine from the Thames Valley University. He is the Vice President of the Ayurvedic Practitioners Association in UK. He is the Chair of the Institute of Ayurveda. He is also the Director of the European Herbal Practitioners Association. And if those of you who were at the session earlier, you might recollect that Dr. Bodekar mentioned establishment of a working group for Europe to promote Ayurveda. And I was there at that meeting, and Mr. Nigel Hubers played an important role in getting all of these people together late yesterday night. I invite Mr. Nigel Hubers to make his presentation, please. Mr. Nigel, please.
Good morning. It's a great honor and privilege to be here, and I'd like to thank the organizers for this fantastic event where we feel connected to the huge body of the Ayurvedic community internationally. I'd like to thank Professor Bodekar as well for putting this event on, which I think we all believe is absolutely essential for the understanding of how India can help propagate and promote Ayurveda throughout the world. Although I'm speaking on behalf of the Ayurvedic Practitioners Association in reference to the UK, the same conditions or similar conditions are apparent in the Republic of Ireland as well. Sorry, there are two areas that I'd like to focus on. Firstly, I'd like to focus on the regulation of practitioners in the UK, and secondly, I'd like to focus on the regulation of medicines, which are rather a stumbling block for UK practitioners. In the past, the UK practitioners were governed by the Medicines Act, which is 1968. And we're still covered by that until the implementation of the Traditional Herbal Medicines Directive. We've also, in 2000, there was a report on complementary and alternative medicine at the House of Lords, and they required a working group to be set up, which is the Herbal Medicine Regulatory Working Group, which reported on in September '04. And what they required was to set up a joint working group, all those involved in not only Ayurvedic medicine but also herbal medicine and acupuncture, to be set up to regulate the practitioners. And we regarded that as a milestone of importance. We regard the regulation of the practitioners as essential for their approval. Historically, before 2005, there was a sense of disunity and disharmony in the UK. The Department of Health recognized that the Ayurvedic practitioners weren't a cohesive body. There was a lot of rivalry and a lot of argument. And there's a lot of confusion about what it was that constituted the Ayurvedic community. That gave rise really to the requirement to set up a national organization, and that was done so in March 2005. So the Ayurvedic Practitioners Association then took under its wing the Maharishi Ayurvedic Practitioners Association, and also the Association of Medical Ayurvedists. And we started putting together a group of people who would then negotiate with the government and promote education and set educational standards. The APA joined one of the stakeholder groups, the European Herbal Practitioners Association, and it's the European Herbal Practitioners Association that are actually very focal and influential in all the debates that are going on and negotiations with the government and with the European community. The APA really is a very special organization in that it seeks to harmonize all the Ayurvedic practitioners in the country. We actually have very clear objectives. We want to promote the education process, we want to improve educational standards, and we want to encourage and inspire Ayurvedic practitioners to practice. The graduates at the moment are not actually practicing as much as they should be, and they're not promoting Ayurveda in the way that they could be doing. And it's the Ayurvedic Practitioners Association, together with the Institute of Ayurveda, that are actually helping to promote their introduction into practice. Education in the UK is pretty well developed. It's not developed as highly as it could be, but it certainly is pretty well developed. In the 1990s, Dr. Maruf Atiq established the College of Ayurveda and set up a 3-year diploma, which ran until 2005. It was subsequently succeeded by a BSc program, and then a postgraduate diploma for medically trained professionals, and also an MSc program, master's program. And that's, again, bringing the standard of education up for Ayurvedic practitioners. In 1999, simultaneously, another organization set up a degree course at another university, Thames Valley University, which is where I studied. And then they then subsequently set up another BSc course in 2004. Again, that's still running. There are approximately 200 qualified graduated practitioners in the UK, and some of them are Vaidyas, some of them are doctors that have upgraded their qualifications, such as Don Brennan. At the moment, there are roughly only about 50 in practice. And of those 50 in practice, probably only about 10 of them are earning a living from practice of Ayurveda. So we're not really taking, there's plenty of scope for increasing that. The APA runs continual professional development programs, usually on a monthly basis. And last weekend, we were very fortunate to have Dr. David Frawley to visit. And next year, we have Dr. Vasant Lad, Dr. Vaboda, and Dr. Renade also is coming, Claudia Welsh. So we're very lucky to have gained the focus for great teachers of the world. In terms of other aspects of education, the Institute of Ayurveda, which is a healthcare charity, which is whose objectives is to help provide free or low-cost treatment for the public, is also running trying to run some courses which are specialists, and that's what we'll be talking to the Indian academia about. Currently, there are 7 therapy schools, and there are approximately 50 therapy centres. At the moment, there are absolutely no research facilities in the UK for Ayurveda. At the moment, statutory regulation is coming on board, and as practitioners, we're going to be regulated by 2008. We're currently stakeholders, or part of a stakeholder group in discussions with the Department of Health, and that means that we have we can put in a very major input into the discussions. At the moment, we have 2 Ayurvedic practitioners, both Dr. Maruf and Dr. Deepika Gunawan, sitting on that council. And their job, the joint working group, their job is to make recommendations to the Department of Health as to how Ayurvedic practitioners are going to be regulated along with the other herbal practitioners. So the government in the United Kingdom is actually regulating the practitioners, so that the only people that will be allowed to practice and call themselves Ayurvedic practitioners will be those regulated by the government. And we feel that's a very positive step to full recognition. That will also give us access to the National Health Service, which is again another very important milestone. The idea really that's coming out from the government is that Ayurveda will not be recognized, will not have its own regulatory organization directly under the Ministry of Health, but actually will be a member of an umbrella group, a CAM council with its own separate office regulating the aspects that particularly relate to Ayurveda. The idea really is that we submit during these negotiations minimum standards of education, and it's been quite a fight to actually get the government to agree that Ayurveda, instead of being a 3-year degree program, should be a 4-year process of education. And we're working also with the Indian government to get them to approve that 4-year syllabus, so that both the Indian government and the British government appreciate that Ayurveda isn't just simply another bodywork or healthcare system, but it actually is a very holistic traditional medical system which requires a great deal more training than other parallel disciplines. Not only is the Joint Working Group responsible for the standards of education and setting minimum standards, but it also will set up an ethical group and be regulating and setting disciplinary procedures as well. And they'll also be looking at continual professional development, which is going to be a prerequisite to maintain registration with the government. And as I said, that will be coming on stream in 2008. Of course, there are many advantages. There are many advantages to becoming regulated, and there are a few here. But in particular, the regulation comes about in order to provide protection and safeguard for the public from what might be called quacks and under-trained people. At the same time, the medicines are being regulated, and this is an area which the Ayurvedic community, not only in the UK but in the whole of Europe, is being immensely threatened, and it's an area that we really do need not only the Indian Ayurvedic pharmacy industry, but also the Indian government to fully participate in negotiations with the European community. It's absolutely essential. This is a vital, vital part, and if there's any messages to be passed along the line, both to the pharmaceutical industry and also the government officials in Ayush and the education department, is that they must get involved in the negotiations with the European community, and they must do it now. The negotiations and the regulations are already starting to be put into place. By 2011, they'll be fully in place, and they are very, very stringent in terms of the control of medicines and licensing of products. And we need your help, and we need your involvement. The licensing of the OTC products under the directive are particularly stringent, since at the moment the requirement is for Western standards to be applied. And those require 30-year proof of efficacy. They'll also involve something like 70 to 150,000 pounds, which is a lot of money, to register each product. And again, we feel that that is prohibitive and will probably put more companies out of business than bring them back into business. So we need the involvement and the effort by the Indian government and the pharmaceuticals to be involved. The APA is now establishing an approved supplier list, and the approved supplier list will be of pharmaceutical companies importing into the UK that have actually complied with heavy metal testing and the biotesting. It's going to be, again, that's a requirement that we're going to be putting onto the Indian pharmaceutical companies. We will not be endorsing products where they haven't produced adequate documentation and had external auditing of the exports. And that's a very important issue in terms of developing confidence, not only in Ayurveda, but also in the medicines as well. The therapies in the UK are now coming under scrutiny. And what we're doing at the moment is setting up minimum standards for therapies as well. And there is a move to set up a 3-year degree program for therapies as well. The Institute of Ayurveda has been established as a charitable trust, and it has been brought up with to develop the 4 branches, or 4 legs, the Chatushpada. What we want to do simultaneously is develop the therapies, the practitioners, the medicines, and the patients. And the objective of the trust is to set up charitable hospital in due course, and again we'll be looking for support from India as well. There are some web addresses, www.apa.uk.com, which has got a lot more information on it. www.ioa.uk.com as well relates to the Institute of Ayurveda. So what we need from the Indian government is we need involvement, government-to-government interaction with the UK and also with the European Union. We need access and participation in research programs, invitations and exchanges. We are insisting that the pharmaceutical suppliers produce traceable and audited standards and meet toxicological standards. We need assistance with educational programs at all levels. And we want the Indian community or the Indian government and nation to participate, campaign, and be involved in representative groups in Europe and feedback what their findings are into the Indian government, so that the Indian government can then be much more present within UK and Europe and be proactive. So thank you very much. And